Good day, mates, and welcome to this incredible episode where we're going to watch one of the most amazing, most mind-bending, most game-changing techniques I've ever seen in the world of dentistry. Now, I've been running around these woods for many years looking for the best handoff I've ever seen between dental assistant and patient, and I'll tell you what, here at Wilkinson Dental, I've encountered in the brush of the underworld, of the back alleys, of Battlefield Road. It was incredible, amazing. I want you to watch it for yourself. And I want you to look at the 10 steps that a great dental assistant can have that will allow them to get the biggest and the best and the baddest patients the best care they've ever received.
Okay, Brady, our new patient here is going to need to come back for some treatment for some failed restorations. I printed her treatment plan if you could check over her insurance coverage, and then I have her x-rays and IOCs printed for her to take.
Okay.
Can I bring her up in a few minutes?
Yeah, it looks like her insurance is right. I'm just going to highlight what her out-of-pocket will be. Let her know it is an estimate.
Perfect.
Alright, Brady, we got everything finished up with Erin's first appointment, all her preventative care today. Dr. Wilkinson does need to see her back as soon as possible. We do have a few restorations that are leaking and failing that will need full coverage. So if you could help her find an appointment and help her with her insurance benefits, and she does prefer Tuesdays or Thursdays. Erin, do you have any treatment questions for me about your next visit? Okay, well, it's nice meeting you. You're in good hands with Brady.
Thank you.
All right, hi Erin. How are you today?
How are you?
Good. Did everything go okay today?
Sure did.
Awesome. So this is our treatment plan. This is going to show what Dr. Wilkinson saw that he's wanting to get done right away. And it does show what we're estimating your insurance to pay. It is an estimate. Anything that they don't pay, you will be responsible for. So it's got showing that and your total out-of-pocket there. And Tuesdays work better for you. And afternoons?
Afternoons would be great.
We actually just had somebody cancel. Would you like me to get you a card, or would you like to put that in your digital calendar?
Yeah, digital calendar is fine.
Okay, great.
Thank you.
Now, I know you're speechless because I was the first time I watched this footage. Now, we're going to go look back and review each step that Lauren took to assure the quality of this patient's experience. Now, my video team has included state-of-the-art visual and audio clues that can tell you when we're talking about an important point.
Okay, Brady, our new patient here is going to need to come back for some treatment.
And now we can see that Lauren's coming out swinging. She's coming out with the patient's name, and she's coming to the front desk early to give them some advance notice that she's bringing the patient up. Now, this is going to be critical so that the patient doesn't even know they're getting good experience until it hits them right in the face.
For some failed restorations. I printed her treatment plan.
Amazing. Lauren has printed out a hard copy of the treatment plan so that the patient knows exactly what the front desk person is telling them when they come up.
You could check over her insurance coverage, and then I have her x-rays and IOCs printed for her to take.
Okay.
Can I bring her up in a few minutes?
Yeah, it looks like her insurance is right. I'm just going to highlight what her out-of-pocket will be. Let her know it is an estimate.
Now, this is critical that you get the treatment plan highlighted and stamped so that there is no question what the front desk person needs to talk to the patient about when they come up to the desk. Now, we do this because there's no need to cause the patient to be skittish or nervous in any way.
Alright, Brady, we got everything finished up with Erin's first appointment, all her preventative care today.
Now, would you look at this? Before the patient has even finished walking up to the desk, Lauren has given an accurate description of what they've done with the patient that day.
Dr. Wilkinson does need to see her back as soon as possible. We do have a few restorations that are leaking and failing that will need full coverage.
This kind of verbiage is absolutely breathtaking. Lauren is communicating exactly what the patient needs to have done in a way that conveys a feeling of importance and urgency.
So if you could help her find an appointment and help her with her insurance benefits, and she does prefer Tuesdays or Thursdays. Erin, do you have any treatment questions for me about your next visit? Okay, well, it's nice meeting you. You're in good hands with Brady.
This is a golden closing statement. Lauren has communicated what days are best for the patient and tells that to the front desk person that they need to schedule an appointment. This is not a question or a suggestion. This is following up with that sense of urgency that makes the patient feel like they're getting the best care they've ever received. Then she asks them if they have any questions and endorses the financial coordinator. This is absolutely incredible work. And the patient is completely confident that the same treatment they received during Lauren's appointment will be sustained through this financial conversation.
Thank you.
All right, hi Erin. How are you today?
Good, how are you?
Good. Did everything go okay today?
Sure did.
Awesome. So this is our treatment plan. This is going to show what Dr. Wilkinson saw that he's wanting to get done right away. And it does show what we're estimating your insurance to pay. It is an estimate. Anything that they don't pay, you will be responsible for. So it's got showing that and your total out of pocket there. And Tuesdays work better for you. And afternoons.
Afternoons would be great.
We actually just had somebody cancel. Would you like me to get you a card, or would you like to put that in your digital calendar?
Yeah, digital calendar is fine.
Okay, great.
Thank you.
From giving the front desk advance notice all the way to endorsing the front desk receptionist as she walks away, this is a prime example of a wonderful handoff. Now I want each of you to remember these things and apply them in your day-to-day workings. These patients could potentially be snapped up by other clients and practices if you are not able to successfully apply these skills in your dental adventures. Happy hunting, everyone.